Hi, everyone. Good morning and good afternoon. My name is Tanvi Pandit-Rajani, and I am the Private Sector and Health Markets Lead at JSI. In 2020, I joined my organization's Anti-Racism and Equity Task Force alongside a group of 25 other passionate and committed colleagues who represented various backgrounds, levels, and roles across our organization. Our mandate was to create an action plan for addressing and advancing equity, diversity, and inclusion. The task force marked the beginning of my workplace EDI journey, and today I am part of a core group of fellow change agents who've been selected to help move the implementation of that plan forward. In this role, I was tasked with helping to create EDI metrics that reflect our global workforce. The challenge? While there are many EDI metrics out there, few consider the application of these measurements to multinational organizations, and even fewer consider the application to global health and development organizations. Many who have project-based business models that are highly influenced by our external funders. So spoiler alert, this presentation does not end with a list of meaningful metrics, but rather it focuses on my own EDI journey alongside dedicated colleagues and the process that we're taking to getting us there. In 2020, our organization, like so many others, embarked on an initiative to be more responsive and more deliberate about addressing racial as well as other inequities experienced in the workplace. In the interest of time, I won't go through the details of our internal activities, but I share this timeline for a few reasons. One, to be inclusive and create spaces for staff voices and experiences to be heard and reflected in our work plan, the process takes time. Two, we engaged external expertise to conduct surveys, EDI training, and facilitate planning. Three, my WomenLift journey began while I was in the midst of this work, which only reinforced my learning and growth around EDI, especially with respect to the inequities faced by women in the global health field. And lastly, while our work was heavily influenced by our external environment, we are experiencing internal shifts as well, as we brought on a new senior EDI advisor last year, and in January of this year, we welcomed a new CEO. In June of 2021, our plan was drafted and shared with all staff, and we view it as a living document meant to evolve and adapt as we learn from our implementation efforts. The plan is organized by 5 interrelated, mutual reinforcing strategic domains. I was selected to oversee the implementation of actions that sit within the corporate culture domain, and one of the first tasks included creating metrics for action plan implementation. As global health professionals, our work is rooted in data and measurement. We are about creating change in behaviors, change in practices, change in policies and processes to ultimately improve the health outcomes for everyone. Equity is at the heart of what we do. And to understand whether the change we seek is occurring, we measure it. We measure at every step our inputs, our outputs, and ultimately our outcomes. So when I started to think about metrics for EDI, I couldn't help but see the connections between how we go about doing the work that we do out there and how intrinsically linked it is to the work that must be done in here. Global health organizations like ours are in uncharted waters when it comes to EDI. Experience and experimentation with what we measure, how we benchmark, how we monitor, and how often is rapidly evolving, and it's a sensitive endeavor. Moreover, to be truly meaningful, the design of our metrics must reflect our culture, who we are, and who we want to be going forward. So before taking that step forward to design metrics, as our action plan called for, I took 2 steps back to ask myself some guiding questions that might help inform and anchor and align our action plan to broader organizational change. These questions focus on our internal ecosystem, recognizing that to a large degree, our practices and processes and our people are also influenced by our external environment. For example, some of the questions that I sat with, might it be time to revisit our core organizational values? And to what extent are these values shared across the US and globally when the societies and cultures that we belong to are so varied? Importantly, CEOs set culture. And during our first organization-wide meeting with staff, our new, and I'm very proud to say female, CEO raised an important question. She asked, what does a culture of learning and belonging look like in 2022 and beyond? The addition of that B for belonging is an important one, And I look forward to working with my colleagues to meaningfully answer and measure how we respond to questions like these over the next year. As I've reflected on this past year, I realize what a year it's been for women who've arrived into spaces where they are making history, where they will influence change, and where they will make a positive disruption. And this includes you, my fellow 2021 WomenLift friends. While my journey and my work on this project continues, I'd like to end my presentation with a quote from my new favorite poet, Amanda Gorman. Unity that actually moves towards the future means that we accept our differences. We embrace them and we lean into that diversity. And while it probably didn't fit as nicely in her poem, I'd like to add to this belonging too. Thank you, everyone, especially to Andrew Fulham and JSI for their support and to WomenLift for an incredible year.